Welcome to the Smoking Gums podcast. I'm Dr. Tom Larkin, where I introduce you to some amazing people in the dental preventive space. I'm beginning a series based on some individuals that I met at my last meeting in April. It was a tremendous meeting, and it's worthy of many, many episodes to kind of do a little deeper dive of some of the things that came together in that weekend. And kicking it off is someone whose father presented at the meeting and whose company I've got to know a lot about. And so without further ado, I am going to introduce Michael Lazzara, the CEO of Dento
Hello.
USA. So Michael, welcome to the podcast.
Thank you.
So I'm going to tell a little bit of an origin story. Everybody has one. And this one begins here. This is April of 2025. This was my meeting, and Dr. Victoria Sampson, the brilliant Dr. Victoria Sampson from London, UK, came to Lexington to present. This is Dr. Rachel Riley Woody, who you are currently beginning to work with, which is going to be awesome stuff. And I got to spend she stayed a couple of extra days because I wanted to show her Kentucky, and we visited some horse farms. And, you know, toward the end of the 3 days I think she was here, she didn't give me a lot of advice or a lot of directions. She only told me one thing. She said, I need you to contact Michael and Dirk. Okay, that was all she said. You know, she wasn't pitching what she was doing, you know, in London or anything. It was just like, you need to contact Michael and Dirk. So Dirk being Dr. Gieselman, who is the founder of Dental Gnostics in Germany, and you're kind of back and forth to Germany. And I reached out, and we had our first Zoom call. And, you know, one of the things that I always tell people is I'm as much of a student at my conferences as anyone else. I mean, I know a lot of things and a lot of people, but I know what I don't know. And this has been an amazing learning curve for me. We had several Zoom calls, and then I had the privilege of meeting up with you in person around Christmas time. I was in Florida, and you're in West Palm, and had lunch with your father, Dr. Richard Lazzara. And wow, that started off this whole journey, which ended up in having your company present at my meeting. And it was really central to this April meeting. So I'm going to show you one other thing here. This is my favorite picture from the meeting. This is your father on the right, Dr. Lazzara, and on the left is Dr. Brad Bale. And one of the things that we had lunch, and it was kind of, you know, it's just kind of funny how things happen. Your father was asking me kind of how I got involved in this, and I got involved because of the Bale donating method, and your father thought it was interesting, and he really contributed a lot to the weekend, and I know he really enjoyed meeting Dr. Bale and becoming a patient in the Bale donating method. So it was it's funny how the universe works. I mean, the universe is perfect, brings the right people together at the right moment, and so. Yeah, so let's start here. Let's start with a word which you and I have kind of shared, and that's the word longevity. Okay, and one of the things that I have found, and once again, this is all from introduction from you, Miguel Stanley in Portugal, revision dentistry, longevity, all these things that are kind of new terms. Talk to me a little bit about oral longevity.
Sure. So essentially, longevity in itself is a way to describe how well your body is functioning. If all the processes in your body are functioning well, then you will live longer and you will have a longer health span, which is being healthier for longer.
Right.
And as we know, more and more every month with new science that's published, there is a close connection between what's happening in the mouth and what's happening in the body. And what's becoming more and more apparent is that you cannot optimize the health of your whole body if you are not optimizing the health of your mouth.
Amen.
And
Amen.
that's where oral longevity comes in, is that if you want to improve your longevity, you also need to take into account your oral health. And not only that, it's that your oral health can also be an indicator of your longevity. So
Right.
there are all sorts of different tests that you can do for your longevity, VO2 max. Some people do grip strength. But ultimately, all of those different types of tests, even, biomolecular things like the glycans and things like that, are just an indicator of how your body is functioning. But of course, one of the best indicators in how the body is functioning is the mouth. And have you ever heard the phrase, "Don't look a gift horse in the mouth"?
100%, man. I've been around horses, and I know.
Oh, you're a horse guy, of course. So you know why they have that phrase, right?
Right. Yeah.
Because you don't want to judge a gift that someone gives you. Just accept the gift. Don't judge it. And the point is that looking in a horse's mouth is a way of judging the health of the animal,
100%.
because the mouth indicates the health of the animal as a whole. And it's also the same thing with humans. Our mouth indicates the health of the whole body. And what's happening in the mouth indicates your overall bodily, let's say, fitness.
Yeah. You've hit on some things just immediately. You use the term health span. Okay. That's getting to be, a popular thing, because really, we're burdened with so much chronic disease. I don't want to live a long time unhealthy, right?
Mm-hmm.
I want to live as long as I can, as healthy as I can. And that's been my motivation. Everybody knows that I started in the Bale-Donine method 13 years ago, right? And that was an attempt to have a better health span, not a longer lifespan.
Yeah.
I don't, and that's what's crushing America's healthcare right now. So health span is absolutely important. And I can't tell you how underrepresented the mouth is in functional medicine in general. Okay.
Yeah.
Because functional medicine everywhere is exploding. It's just exploding. All different varieties of it, right? There is a group here locally that is just building new clinics here and there, and they don't have a dentist, and I'm just saying, if you can't practice functional medicine without having some representation of a dentist, and that's my very, very strong opinion. So let's talk about what you guys do in particular, because I'm fascinated. I was fascinated when I heard about it, but then when I got to see it, and now that I'm going to get my hands on it, working with Dr. Riley, now this is going to become very real. And this has been a process for me, because as you know, I've been around salivary diagnostics a long time.
Yeah.
And it's a very confusing space. It's been confusing from the beginning.
Yeah.
And because I started using a microscope in my dental practice in 1989, I have a perspective on, I've had some years to pass judgment on it. So in my opinion, you guys have solved some pretty significant problems. And I think over time, this is going to become a standard of care. So when patients, the biggest problem in dentistry is patients appear healthy while they have underlying disease. Okay. And that's been since the beginning of time, right? Yeah. Now, what it depends on is how interested is the dentist in becoming proactive versus reactive. The model in dental school is reactive. Okay. Yes. The model in medical school is reactive. You have a disease and you get a prescription, you have a hole and we put something in the hole. Well, what's happening is that the general public is just, this is no longer acceptable. Okay. The general public is being crippled with healthcare premiums, dental expenses, and they're looking for solutions. So the dentists who are getting in front of this conversation, and I'm working with a lot of them, are very quietly doing very well. Okay. And I use Dr. Riley's as an example in that her practice is closed to new patients, and there's a waiting list that's well over a year. The people are seeking this type of work. So the technology, let's jump into the technology a little bit. I've got a quick slide that I'm going to put up, a couple of slides here. One of them, this was speaking of longevity, this was the handbook that I prepared for my April course, because our focus was really, I have a concern about dental implant longevity and how to support this. And so I created an 80-page manual. It was a physical handout for, and every presenter had a representative chapter. And your father reviewed everything and it was really, this was really a powerful addition to the course. So if we can identify disease before tissue destruction. So I have a brand new, I'm pulling some of these slides off this. I have a brand new learning platform. Everything has been completely redone, using AI to create slides and really make things look better and flow better. And this is a slide from an individual, and this goes back several years, but this was such a quotable quote to me. And this was the case for diagnosis. So this particular dentist had a patient that had an implant fail. He did a salivary test. The test came back very, very positive. And his quote after this experience was, "Everything may seem normal, yet what I can't see impacts clinical success." Okay. So that was like quotable quote. You're going into my slide deck because that's really important. So let's talk about your test, which is a measurable, quantifiable, we're looking at an inflammatory, a biomarker called aMMP8, which I was not very familiar with 12 months ago. Mm-hmm. Let's talk about that in particular.
Sure. Well, as you mentioned, saliva testing can be a bit confusing. There are so many different biomarkers, so many different indications, so many different things to look at because biology is not simple. And so what we're doing here is we're looking at an aspect of our biology. And so what we wanted to do and what we learned over the last 20 years, because that our company's been around for more than 20 years, is that in order for something to be really feasible to implement in the daily workflow of a dental practice, is that it needs to be simple, straightforward, and easy to understand, not only for the patients, but also for the clinical staff. And so what we're measuring here is just one very specific biomarker. We have a patent on measuring that biomarker, which you mentioned. And, this biomarker is essentially the primary agent of collagen breakdown in the body as a whole. So as you know, collagen is the most prevalent protein in your body, but it's also the primary component of your periodontal tissue. And so when we detect that enzyme is active, that means that it's actively breaking down the periodontal tissue. Yeah. And so this is an indicator to us that something is not right, because your body shouldn't be breaking down the periodontal tissue. Your body should be defending yourself from, the pathogens that come in through your mouth, and it shouldn't be harming the body itself. But as we know, autoimmune diseases are becoming more and more prevalent, and we don't often refer to periodontal disease as an autoimmune disease, but that's really what it is, because it's your body's host response that is attacking the pathogens in the mouth, and as a byproduct is breaking down the periodontal tissue. And then this process is actually happening over the course of months and years. In fact, the average time from the onset of this periodontal tissue breakdown process to the time that it's actually diagnosed is between 10 and 16 years normally. Wow. And so what we do with this technology is we identify that process the second it starts on a molecular level, so that you have the opportunity as a clinician to intervene and not only do something about it clinically, but also to make the patient aware of that and educate them about what's happening in their mouth, about the importance of doing good hygiene and periodontal care so that they can actually prevent this process from progressing further and hopefully keep their natural healthy teeth and their existing dental implants healthy for life. And I like what you mentioned about the implants, because we always used implant longevity as a term. And when I saw that on your folder, I was like, oh my God, this is amazing, because this is right in line with how we think. And I had never seen anyone else mention implant longevity. And that's what we try to do, is identify a process on the molecular level months or years before it actually leads to the attachment loss or the bone loss that you would see clinically, because as you mentioned, dentistry has been reactive. And, I would just like to say something about that, which is interesting because I always think about it in terms of, what do people want? And I think in the past, dentistry was probably reactive because that's what patients wanted, right? They only actually wanted to go to the dentist when they had a problem.
Right.
But now that patient mindset is shifting to not wanting to do that, wanting to prevent from ever having to have a more complex procedure, that is what is causing the shift in dentistry to be more proactive, because that's what patients want. And that's ultimately what's going to drive the industry, is what the consumer wants, and the patients are the consumer.
100%. And I just can't explain that enough to dentists, the demand, the patient demand, the change in the psyche of the patients who are wanting this. The problem, and this has kind of been a long-term deal, dentists they get distracted very easily. And the digital workflow that has evolved over the past decade is beyond impressive, okay? 3D printing, scanning, all of these technologies. And this is the engineer side of the brain of the dentist, right? Because it's fun and it's cool. But that's on the reactive end, right? Yep. And so it's always been in competition. The dentist didn't feel like, I have to decide, do I want to be one or the other? Do I want to really be a really good clinical dentist, or do I want to go into this wellness model? Well, I think you can be a little bit of both. I think there's room for both.
Absolutely.
And I think from a responsibility standpoint, if you're doing really complex restorative, you need to get involved in this longevity conversation, because the patient just made a damn big investment, and this stuff should last a while if they spend $30,000, $40,000, $50,000. So now we have, am I really responsible for that by looking at these biomarkers? So the thing that hit me, just square between the eyes and once again, this was a process. We had a couple of Zoom calls, and I not for a lack of, I didn't understand it, but I didn't see exactly where in the sequence where it fit. Meaning, so this is, and I don't want to step on any toes of the bacterial testing people, but bacterial testing from the beginning has been confusing. So one of the reasons why I jumped into this, training the microscopy back then in 2013, was because I told Dr. Bell, and I told everybody that would listen, dentists are not going to understand bacterial testing. The patient, it's going to be confusing. So by using the microscope to bring up the conversation of the biofilm and see it live, gets their attention, you're going to have more success in at least having the conversation. But then what happened is dentists began to test, and then they get these tests back, and it's, their levels are above, the pathogen levels are above threshold. Well, then you have to understand threshold, and you have to understand what this means. Well, what I've come to understand after seeing your test, which is totally logical, even having a test over threshold really doesn't tell me today what's happening in my mouth. I could potentially have pathogens over threshold and not have collagen breakdown. I could have a very robust immune system. And I've seen this in younger patients with the microscope, dysbiosis, early 20s, no pockets. If you use the naked eye, you'd pass them every day. You take a slide and put it under the microscope, and oh my God, he goes, look at all this bacteria. They got dysbiosis, but they're handling it, right? So then that gets confusing. So, but what your test does is it tells us today, it quantifies, it puts a number on it today. And then that's what really changed things for me, because now we're having a more meaningful conversation and a less confusing conversation, because that bacteria above threshold, how to treat it, when to treat it, how aggressively to treat it, and that has been an ongoing confusing conversation for everyone. The other thing that is just absolute standout for me is that this test is point of care. And I've always been looking for point of care testing. Mail out laboratory testing, there's a time component with that, depending on how an individual practice, whether it's the hygienist or the dentist, however it's handled. So this test goes to the laboratory. The results are uploaded somewhere, somehow, but you're going to have to interface with that patient to go over the results. Okay. That is a significant time component that is not being properly factored into. And as far as I'm concerned, because most practices today are under significant financial pressures for a host of reasons. And to me, time becomes the most important component of your practice, utilizing your time. So to me, for these people that have a wellness-based approach, which means their initial patient examination, that initial intake, can be a 2-hour, 2.5-hour appointment. It's comprehensive, right? Now you have time to go over this. And with your test, now I have the results. We're actually going home with, we looked at the biofilm with the microscope. We went through the training, the teaching, the awareness, and now we have a number as to where you're at today. That's a kind of a game changer to me. It really is.
Yeah, and I think I think that the bacteria testing and what we do is complementary, because what we do is essentially the first step, and as you mentioned, it tells you what's happening right here, right now.
Right.
And if you find that right here, right now, there's an issue, then of course you can look into it deeper with the laboratory bacteria testing to see, what could be the cause of this issue.
Correct.
And how might we get this under control with certain treatment decisions that we would make based on that.
Right.
Well, but even with the microscopy, it's interesting because you have the pathogens that you see in the mouth right here, but what you don't see with any sort of microscopy or bacteria testing is how is the body responding to the bacteria.
Right.
Each person is unique, and every clinician knows that they have patients with great hygiene, but they have periodontal problems.
Right.
And they have patients with terrible hygiene, but periodontally, they're totally fine.
Yeah.
Because each patient has their own unique host response.
Yep.
And that's what the active aMMP8 is going to tell you is how is our immune system responding right now to the pathogens in the mouth? And we call that immune fitness, because periodontal disease is a function of your immune system. And so what it allows clinicians to do is it allows you to personalize the care that you're doing for your patients. Because for some patients, coming in twice a year might be totally fine. But for other patients, coming in 3 or 4 times a year might not even be enough for whatever reason. And that whatever reason could be anything impacting your immune system. Of course, genetics, chronic illnesses, but even the everyday things like diet, vitamin supplementation, psychosomatic things like stress, sleep. All of these things are impacting how your immune system functions, and then ultimately outputs into what's happening in your mouth.
I love that. I'm taking notes. Immune fitness. I love that. And then, personalized care. So modulated therapy, I learned decades ago. That was a term that Dr. Kai's used in teaching microscopy, and that every patient is unique. So ReCare, it was set up basically how the biology of the mouth was responding. Some people needed to come in once a month. Some patients come in once a year, and that's what you're talking about in immune fitness. So that's why I'm saying that's what hit me square between the eyes, and that's why I put this testing ahead of bacterial testing. Okay, in the sequence of things, right? And that was a kind of a big moment for me to sit there and say, because people know that I have a lot of experience with this, and they kind of rely on my opinion. And I'm going, no, this is like every new patient, every ReCare patient. This test is so straightforward. This is where we are monitoring the immune system, right? The immune response.
Exactly.
Yeah.
And the pathogens, of course, are good to know, because if you're having those, dangerous pathogens in your mouth, your immune system may be dealing with it well right now, but at a certain period of time, that may not be the case, because as we get older, our immune system doesn't function as well. And that's where the oral longevity comes in, is essentially, at some point when you get older, your immune system doesn't function as well as it used to. And that's why periodontal disease is a factor of age. The older you get, the more likely you are to have it,
Yep.
And that's because your immune system isn't functioning as well.
Yeah.
And one of the things that supports your immune system's functioning is by removing the trigger factors. So these dangerous pathogens are trigger factors that put burden on the immune system. And so by detecting them, you can see that, hey, this is a risk factor for the future. This is not a good thing. And we want to make sure that, we get rid of these pathogens because, well, even though it may not be doing any harm right now, at some point it could.
Yeah. And this is a significant forward-facing, meaning, you're able to detect before clinical symptoms come in. What period of time? 6 months, a year? I mean, well before clinical breakdown?
Up to 5 years based on some studies that have been published.
Wow. Okay. So you mentioned, I'm going to bring up one other slide here. You mentioned vitamin D. And this was another little snippet of a podcast between Christian Coachman, who works with Coyce, and Miguel Stanley, who's in Lisbon, who I want desperately to visit his practice. He's doing some amazing things and very, very much an authority in Europe in using your technology because he's done it for a while. And he did this little podcast that he did a study. I think it was like 1,100 patients in his practice of the aMMP8 and vitamin D3. And to his amazement, there was an almost an absolute correlation between that, meaning there are so many patients that are deficient in vitamin D and how important this is to perinatal health, to overall health. I learned about this because I was, most people that are not really on top of their health are probably deficient. I learned about it through the Valdolin method. I began to optimize D3 around COVID. And when I mean optimize, I run, I guess I would call it running hot, way on the high end. And I swear by it. Okay. I think it is really, really important. And once again, 6 years worth of doing that. So this is another factor. And talk about, so you have the capability coming, not right this minute, but your device in Europe can detect chair-side D3.
Yes, it can. So we haven't introduced it to the US yet. We will. I can't give any details right now, but yeah, same machine. But the difference is that the sample is taken with blood instead of with saliva.
Wow.
And it's the same machine, and it takes 15 minutes for the vitamin D, whereas the active aMMP8 takes 5 minutes. Wow. So just slight differences. And taking a finger prick is pretty easy for anyone to do. And as you mentioned, yes, it's extremely important. So what Dr. Stanley showed essentially was that the patients who had low vitamin D, which is bad, had higher peaks of their active aMMP8. And the patients who had high vitamin D, which is good, they had lower peaks of active aMMP8, which is good. So if you look at a chart like this, you can see that the patients with low vitamin D, their active aMMP8 was spiking. But when patients had high vitamin D, the active aMMP8 was dampened. And so thus the tissue breakdown was dampened because, as we know, vitamin D supports the immune fitness and thus supports how the immune system is responding to the pathogens in the mouth.
Yeah. I love the term immune fitness. I wrote it down when you said it. I'm going to start using that. You guys come up with some really, really good stuff. Okay. So here's a question on integration into the hygiene appointment. Okay. Because I get this question all the time about everything. Because as you know, what's unique about my conference is that it gets into, I'm not so much at the 30,000 foot level telling people that the mouth is connected to the rest of the body. Right. It's more about practical technologies that can be implemented Monday morning. Mm-hmm. Okay, how do we do it? Mm-hmm. So, it's laser, microscope, ear test, air polishing, all of these technologies. Because what I saw was that their dentists like to put things in their hand. They like to touch it and feel it. And that's why we had the clinical day where Anita and your team showed people how to do it chairside. And so many people said that made all the difference in the world to actually see it,
It does make a huge difference. Yeah.
have the test done themselves. So implementing this into an appointment, because I get this question and I tell them, they'll ask, because first off, most dentists, most hygienists are pressed for time. They're just absolutely pressed for time. Okay. Yep. So you can't ask them to do an additional thing. So what I tell them, and microscopy is a perfect example, I'm going to change the conversation. And by changing the conversation, I'm going to save you time, and I'm going to promise you that I can save you time. Meaning, introducing microscopy is one. When you show the bacteria and you have their immediate attention, and then you take your test, and we have a number to kind of quantify things, we have replaced a conversation about pockets and bone loss. That conversation is really, to me, kind of a worthless conversation. Once again, it's retrospective. So you have a 4mm pocket, okay, and that is a conversation that a patient just glazes over at. What does that mean? You're going to hear me call 4, 5, 4, 43, and they're just like, what the heck's going on, right? So we're replacing that conversation with a much quicker diagnostic workflow, and it saves time, okay? And I stand by it, okay? And hygienists that implement that, they're like, you can't take that away. They will not go without their microscope, because they know it's like a cheat tool. It's like, I just show them and they go, oh my gosh, what are we going to do? Now we got to move on to treatment. Mm-hmm. So same thing with your test. It's very, very straightforward. Did you say 5 minutes after the sample is taken that you get a reading?
Yeah. So we've optimized the process so that it can be as seamlessly integrated into the workflow as possible. And so normally what works best is that the sample is being taken by an assistant or even potentially someone from the front office.
Okay.
They just sit the patient down into the treatment room. They hand them a little cup with some water inside. They swish the water in their mouth for 30 seconds, and then they spit it back into the little cup and hand it to the assistant. And then the patient's job is done. And then the hygienist or the dentist can now start their treatment or their examination, while the assistant takes the sample over to the machine, puts that little mouth rinse into the machine, and then in 5 minutes, the machine will give a result. And a lot of times the result is already ready by the time the assistant or the dentist actually comes into the treatment room, so that they can then do, their clinical examination and discuss the results with the patients. Yeah. And I totally agree with you that patients don't really comprehend what's going on with their probing depths and radiographs. We as a company believe it's still extremely important to do that, because we believe that the probing and the radiographs is like the GPS in the car, like where are we? And what we do is more like the speedometer, where are we going and how fast are we going there? And so you need both pieces of information to support your clinical decision-making process. But when it comes to patient communication, absolutely, it's going way over their head. And that's why the microscopy is so cool. And that's why what we do is so cool, because we give them a simple understanding of what's going on in their mouth with a, red, yellow, green, what's your score? And patients understand a score.
100%.
And everybody has wearables right now. I have a Whoop and an Aura. People have Apple Watches, and like the Apple Watch or the Aura, it's always giving you a score. You have all these different scores. And that's how people are understanding their health these days. And so no one's getting a score about what's happening in their mouth. But now that they can get a score, they can understand, okay, this is my oral fitness score. Either I'm in the green and I'm doing good and I need to maintain that.
Right.
Or I'm in the red and I need to think about what more can I do at home? What more can I do in the office? And that's where this type of screening supports the organic growth of the practice by getting patients to understand that they do need to do something more, and not only in the office to grow the practice, but also at home to support the work that, the hygienist is doing.
You just reminded me of another slide. Okay. So this is a slide from my training. The case for what does this mean? Okay. So a patient's going to ask, what does this mean? So this is essentially what you just explained. It means that your regular dental cleaning appointments have taken on a new importance. Okay. We now know that the health of the mouth directly affects overall health, and we want to be proactively on top of this. So they're going to understand that a score of 20, right, might be acceptable. And if it's 60, but what you're doing is, from a trend standpoint, you're identifying in advance the moment there's a change. That patient is going to understand the importance of their regular visit. Okay. The number one KPI in a dental office is, and I go through this in detail in my training, is retention in the hygiene department. Meaning, people cancel on a whim. If it's a spring day, I want to go play golf. I got a dental appointment. Man, I'm not showing up. I'm going to play golf. Well, if I am an insulin dependent diabetic, or I have any other host of diseases, and I understand that I need to watch this score, and I need to know if this score pivots on me, I'm going to make that appointment. Okay, that's how the practices in the future are going to create value in the hygiene department. That's what Dr. Riley has done. That's what Victoria Sampson is, taking the world by storm in UK. Mm-hmm. They're having different conversations that patients are relating to, because having your teeth clean has historically been for one reason only. I like the way my teeth feel smooth for a few days after I get them clean. Mm-hmm. That's all the patient knows. The teeth feel smooth. Yeah. That's it, right? Now we're changing everything. Now we are talking biology, and no different than being a patient in the Baldoni method, where I have my lab. I alternate between primary care and Baldoni physician. So I'm having labs drawn 3 to 4 times a year and looking at the basic inflammatory biomarkers, cholesterol, A1C, whatever. But what I've learned is that you're looking for trends and pivot points. When I look at my stuff over 10 or 15 years, I'm looking at, oh my gosh, what caused me to bump up this quarter? Okay. Or if you're a dental patient that's coming in twice a year. And I think, just like you were talking about with the wearables, this is the suite of information, of data, that patients want going forward for their entire overall health. And now that we know that the oral health is absolutely essential to this overall holistic view of health, that's a part of the data set that I want. I want that. How many hours did I sleep? Was it good rest? What's my resting heart rate? How many steps today? This is so obvious to me. Obviously I'm an evangelist for it, and you are too. And a lot of times it's frustrating that there's just so many people we can't get through to, but it's real obvious where it's going.
I think that's the beauty of the score, is that it does sort of catalyze the patient's behavior in a way that was never possible before.
Right.
And, if I have a wearable, by the way, when I did a conference a few weeks ago, I asked who had a wearable, and literally 85% of the room raised their hand.
Wow. That's impressive.
It's really crazy. And it was definitely not the case 5 years ago.
That's impressive.
So, but yeah, the whole point of the wearable is that when I do the behaviors that don't support my overall fitness and longevity, like drinking, like eating heavy meals late at night, like looking at my screen, late at night, I can see the impact on my score. Before I had the wearable, I was not able to see the impact on my well-being because I didn't have the score. And therefore those recommendations kind of just went over my head. Oh yeah. Okay. What's one beer going to hurt? What's one glass of wine going to hurt? Right. No, actually, now that I have the wearable, I can see one beer has an impact on my sleep score. Yeah. And that's what catalyzes the behavior change. And now we can bring that to dentistry and say, look, here's your score. It's not me, the dentist, saying it. It's a scientific machine, and we can do something about it or not. It's up to you.
Yeah.
And then when you come back, you're going to see the impact of the treatment we did and of what you're doing at home. If the patient doesn't do what they're supposed to do at home, then they're going to see the impact on the score.
Yeah, no, this is great. This is great. I got another slide I'm going to put up. So this is the opportunity for dentistry and this is kind of toward the end of one of my presentations, this is where I see things going, and AI has a big component of this the next 2 or 3 years. And this is kind of quantifying and bringing this all together. Okay. Advanced analytics, right? We're still fragmented with our results. I've talked to 3 different AI voice companies. I'm talking to one tomorrow. I really have a vision for this. And once again, this is time saving stuff, and it's going to happen. And so basically what happens is, with the point of care testing, getting the data set, whether or not you do further salivary diagnostics, biofilm analysis, and now we have some type of an integration. We need an integrated platform with a medical professional, because this information needs to go back and forth, right? It needs to be supportive in nature. It's going to happen, and dentistry, it says, may become one of the most important preventive healthcare platforms. The potential is there. It is just, and I think it's going to happen. I really think in the next few years we're gonna see some pretty important advances with everything. And I really am just, and I think one of the things that's important for my audience to know is that, your company's been around 20 years in Europe, right? This is nothing new. The introduction into the United States may be a couple of years old, but this is certainly not new technology. There's research up the wazoo that you can send. I tend to have people that really, I need studies, and that's fine. But no, this is nothing new.
I think it's interesting what you mentioned about the slide you just showed, which is the integration of all the data.
Yeah.
And one thing that we really invested in over the last few years is building an integration of our machine with the patient management system. And the first patient management system that we decided to integrate the machine with is called Epic. And if you haven't heard of Epic, it's the most commonly used medical patient record system. So anytime you go to a hospital, they're pretty much on Epic. So that means that if dentists started using that, then which at some point they might, not some do, but not all of them do. There are some examples like Pacific Dental that uses it, but
I think they help.
Every medical doctor can see a patient's active aMMP8 from their mouth, because that's relevant to a patient. If a patient has diabetes, if a patient has cardiovascular disease, if a patient has arthritis, if you have a pregnant woman, if you have someone who's trying to get pregnant, these are all conditions where having optimal oral health is crucial. And so that's why in Europe, we do have a lot of medical physicians in those different fields using this type of saliva screening, not really to necessarily do anything in the mouth, but to simply inform the patient, look, you have an issue in your mouth. You need to get this taken care of if you want to get pregnant, if you want to have a healthy birth, if you want to improve your diabetic or cardiovascular outcomes.
Yeah, it's part of the differential diagnosis. I mean, and it's like I said, the people here that are completely ignoring the mouth, it's a lot. The physicians who do, but they don't know what to do. They're still at a loss. Even the ones that get the bacterial test, it doesn't give them this information, right? Mm-hmm. And so, no, that's why I came away from our meeting just over the top excited, and just really, really, with a clear view of where I think things are going the next 12 to 24 months. Yeah, I really feel that way. Mm-hmm. So, no, this has been awesome. So, is there anything else? Any other bits of wisdom that you want to pass? I want to do a more extensive webinar. A little different than the podcast format, but this is so conducive to a webinar that I just need to blast out to lots and lots of people, both lay people and professionals. We just need to educate. All of this is about becoming knowledgeable and educated, and this is very straightforward. That's the important part too.
Yeah, exactly. No, the only bit of wisdom I want to share is simply that what I said at the beginning, which is as dentists and business owners, it's important to never forget to put yourself in the shoes of the patient.
Yeah.
And remember that what the patient wants and what the patient expects should always be number one.
Yeah.
And for all the great things behind this type of saliva screening technology, all the science, all the clinical relevance, and all that kind of thing, the most important thing is always going to be the patient experience.
Yeah.
And this is something that is going to improve the patient experience because they're already getting that experience on a daily basis from their medical physician, from other consumer products that they're wearing. And so this is something that they're expecting when they're expecting it from a healthcare provider, and dentists need to think of themselves that way, I believe.
100%. No, this is the dentist that I want to go to. I mean, if I go and I come away without this information and I know about it, I won't feel like I had a complete exam.
Exactly.
Right. Mm-hmm. So that's where I think we're going. All right. So I'm going to put up a slide here with, there's your contact information. There's your email.
Great.
There's mine. There's a QR code to my website, my cell number. Anybody want to get in touch, reach out. You will be hearing a lot. You're going to hear me talking a lot more about this, but this is my first podcast since the meeting, and I wanted to make this number one. So
yeah, I think we just scratched the surface.
Yeah, no, for sure. Well, thank you. Thank you for your time, Michael. You did
My pleasure. My pleasure. Thank you.
Outstanding. Thank you.